And I'm gonna talk to him and tell him, that wasn't really what you were pitching.
Yeah.
I was trying to bring this back a little bit.
Well, that's what we was rushing.
Sorry.
Frank,
The only thing I heard about this
so that was one of the issues we were running
which I
into with
can
the
see
hardware.
the
We didn't have a problem with using it and
background
there.
noise, so they're gonna talk
For
to
us, it's
myself
like,
the
okay,
rest
if you
of
use it, we should do like anybody else like you, you're gonna take your stuff down, take it out. He was like, well, I've got a podium, we're like, okay, well, then it was like, a podium that turned more things and more things, but we were also having summer camp.
So you
So,
know,
like, you have to take all that stuff
Jimbo
down. So he was, so Angela,
one of those
was
five
like,
military guys.
she wanted to try to find a more permanent place that had stuff. And I was like, okay, I think I found that, because she was asking about the old building. And I was like, I've never even been over there, so I don't know.
And we
They're gonna have a
we
memorial
talked about
service
it,
for
and
them sometime, but.
the action area,
Well,
it's about the size of this area. Longer than I thought it would. Not including her office, so there's a wall right here,
yeah.
and then the kitchen is in the corner, and then that area goes to the rest of the downstairs.
She can be over that lake for twice as hard.
As like a permanent resident, and that's still,
Yeah.
still their place of business, like,
Yeah.
I
really like those miniatures.
I don't mind the stuff on the floor. We gotta arrange it, we gotta take something.
Yeah.
I would tell them too.
I just
I wouldn't have never
The
figured.
history was.
Yeah, so he's been great. When I talked to him, I said, hey, we can't do this, he's like, no problem. He's been very cooperative, and that's what he was like, I don't know. He called me, for feathers, or, whatever, that time period, it's like, after COVID, he was trying to get those back.
Yes, can't do it.
Cleaning up after his back and all of that. But he's not doing that for him, that's what he was looking for. That's where he can have his stuff, and leave his stuff out, because we were making him put it all up after every meeting. So, but yeah, we just had a conversation with him.
Yeah, and I haven't talked to him yet.
Yeah.
And I don't know if he actually started using them. But I just want to see.
Yeah.
Before I got into it.
Yeah, that's, we didn't have any bad issues or anything about it. Just let me know if it don't work out, it's fine too. Just let us know.
And Randy needs to know that.
Yeah.
Draw a line in the sand.
Yeah.
He will stay on his side of the line, he just needs to know the line.
Yeah. Yeah, I'll fix it up with all you.
You know who painted it?
I can't hear you.
You've heard who may not be able to.
No.
I didn't think so.
Y'all gonna have to yell at me tonight. I've got some kind of sign or something on, I can't hear any, like, I can't hear, I just hear anything. Just reach out there. And then, like, if you just stopped up, I see.
He always yells at me,
Yeah, this year.
I was thinking the same thing.
Yeah.
No, it's 97.
I'm the same way, but it's because I use a shotgun on the shoulder.
Yeah. So,
I don't think nobody said anything about it. You're supposed to use some heavy equipment.
yeah.
Right there, that's my nose.
It's coming.
I'm telling you, I wish I'd done it 15 years ago. Here it is.
Interesting, but no problem, it's understanding, but I don't know what stuff. That's just because of mine, his wife says, I think it's problem, it's hard to hear, and it's hard to listen. Probably.
I got tired of explaining that. Hum me no more. Huh?
Yeah, it's just, well, I am not a goose, don't halt me.
Yeah.
I said, "No." Daddy. Somebody says.
That's right. Put myself out of the last day. Yeah, you know.
See, it's hard here, and it's stupid.
How you feeling, lady? Y'all doing all right? How you doing? Are you good? Go on over there.
Give it a minute.
Give it a minute.
After all this rain, I was worried.
Right.
Mike.
Yeah. Yeah.
Good.
Bye.
They, as Loganville, they push us to September. No.
What are you doing, old boy?
Library board.
Oh, yeah. How are you? How you doing, buddy? How's the world? It's here. It's spinning. It's spinning. How you been? Your daughter finished school? Your daughter finished school?
She had, no, she's still doing ballet.
Yeah. She's gonna be an instructor or something.
She will be.
That's good.
She's doing good, though. How about your kid?
Ah, yes, great.
How old's your son?
He's 14.
Eighth grade?
Right, on my way.
Eighth grade?
8th grade.
High school. Essentially just more of that. Real short.
Yeah, it's a little convoluted, and we're gonna have to talk about it. There's a way to fix it without an increase, but it's gonna take a concession of several. Hey, buddy. How's school? Pretty good. That's good. Off to a good start. Awesome. Hey, buddy.
So there will be a need before the end of the year.
I'm sure, yeah. Really?
Go ahead there. So you successfully recruited another daughter into the ranks? Yes. So they're doing well?
They are. They're wide open. That's great. I mean,
We had a bunch of applicants that nobody that had an account.
they had a
So we pulled the ad.
multitude of activities, not just them getting married, and they, got married on honeymoon, came back. Her sister got married. I mean, it's, this weekend, the other girl that was there with, it's not her relative or her best friend is getting married. So like, like in 4 weeks, there's 3 weddings they got going on.
I get to this section.
Yeah.
Can't go any further. The best thing to do there is get all that out of the way the first couple of years. And then after that, it's done. For 20, 25 years, just help each other after that. And you'll probably realize it. Then you kind of like each other.
I think, yeah, it's kind of hard to pick.
They're doing good.
They're all very, very good.
I'm actually waiting a couple minutes for Commissioner Kirk, he's on his way. Number 5 is correct.
Did you get a call from,
No.
I had a couple of things, another little private life videos. This one was different, somebody actually is out there doing it.
No.
Or it's training you, but when screen those ditches, somebody else.
Well,
If he wants us to intervene, so he doesn't have to address his neighbor.
correct. So, not that road, but last week, we got a call from Heels because somebody put up some posts on the edge of the road and now made the other neighbor mad. They want them removed, they can't turn in for campus.
This is our private drive. Every time.
Either that or we go back to legalize and do it.
Yeah.
Right?
We should have a designated location in the county. We just everywhere. We should have a dual location. Close here. We could have a separate lane for dog shootings.
I'm ready to take neighbors.
Bring your neighbor's dog.
I mean, paving roads and just grind them all up, make them dirt. That's where I.
I rode down the Seal Draper the other day, and I think you made a comment about somebody building a fence, right, and I saw it. Well, I got a friend on down in Bedford where this guy is down in there, and he looks like he's built 20 or 25 runs for dogs.
Unless it's zoned as a kennel, I don't think you can do that.
I don't
There's a
think
limit
so.
on the Georgia laws, how many you can have.
Because it's always already got a sign up too, that he'll come and retrieve animals.
You're making a day for all that.
I think he must have moved on y'all's. Maybe this is 3, I'm pretty sure.
I'm moving to District 6.
He's got District 4.
Well, you know, that's gonna be coming up, the folks who know what to do in the district.
All right, I'd like to welcome everybody to the Madison County Board of Commissioners Budget Work Session, August 11th, 2025, 6:30 p.m. We will now call this meeting to order, and we will start off with statements and/or remarks from the citizens on tonight's agenda. All right, seeing there is none, we will move straight into item number 3. Discuss University of Georgia Extension Office 2026 budget request. Travis Hankersby, Madison County A&R agent. How you doing, buddy?
Good, how are y'all doing?
Good to see you again.
All right, so, do we need to go over the specific contract?
Yes, we'll have
for
to-
salaries?
Yep, we can do that, go vote on that tonight, because I know y'all need to kind of get it back done now, so.
And that was just a TRS increase, from 20.78% is what it was previously to 21.91%, with a total increase on the salary portion of $401.83. On the budget side of things, the only thing that we would be requesting is an increase of increase of $450. And what that's gonna do is that's $50 increase for dues and fees, and then a $400 increase for education and training. What we use those for is, each agent has a specific association that they could be a member of. The dues and fees, with that increase of $50, to make it $350 would cover everybody's, in the office, our A&R agent, our fax agent, and our 4-H agent. It would cover their main association dues, for the state and national level. And then going down for that increase of $400, for the education and training. That would go towards, each year, those associations have conferences, both state and national level. And this would mainly just be used for the state association meeting, and that would help offset the cost of going to that association meeting. It's not something that UGA pays for us. They do a lot for us on trainings, but that is one thing that is association-based and not a UGA paid expense. That would cover the registration costs for all 3 agents, not including hotel mileage or anything. That's just the registration, just to help us with offsetting the cost of going to those meetings and conferences.
Travis, actually, we were talking about this line item today, because myself and Susan and Christina were periodically in and out.
Mm-hmm.
Is this, for training here, is it split with any other county, or is this our portion, or how does that work?
This is just us, just Madison County. With Emily, she's the special one with being split between Madison and Oglethorpe. She is able to dip into Oglethorpe and Madison. So with that $600 figure, if we were to pay for everybody's total, it'll be over $2,000.
Okay, that's what we were assuming.
Yeah.
It just
So
was our
it
portion.
doesn't pay for everything.
Yeah.
It just helps offset some costs.
That answers our question from earlier. All right. And going back to the vote that we need to take tonight, because it's your guys' budget, right? Tom, that's why we're doing this tonight?
Yeah, just the contracts,
Yeah,
yeah,
the contract.
the salary contracts, yeah.
Now, are y'all on the state contract? I mean, state pay scale?
Should be, yes, with TRS.
So how is it gonna play in if the state's not doing COLAs this year?
I have no clue.
I'm worried about that, because we haven't got clear confirmation either. Because this increase may work good right up until January 1, and if the state deems,
Mm-hmm.
I don't know how, whoever come up with the math, how they're playing that out yet. Because we've not been told, we just know that there's no state COLAs.
Mm-hmm. And that's something that's not been told to me, from our district office or anything from UGA. This is just what they sent me. And
I appreciate it. No, I appreciate it. All right,
But we
gentlemen.
can talk with Denise if there's anything that we need to, we can get in contact with her, if there's any problems with this at all.
Yeah, I'm worried about for everybody that works for the state, how this is gonna play out, because I just don't know. This is just what we're being told.
So on the salary portion, on the contract component of this, which we're talking about just the contract tonight. So the contract would include the employees that are UGA employees. That does not include the program assistants, correct? They're separate. We have one program assistant.
We have one program assistant and
That's separate. That's
That-
she is entirely accounting.
no. She's also, I think UGA pays for her health benefits. I think they do the benefits package. Most of her salary comes from the Board of Education. And then the county's contribution would be the $5,616 for Ms. Deborah Walford.
So the salary increase we're looking at, proposal is $2,021. That is our portion of the salaries for all the UGA employees. So there's our portion, 4 employees. So if we approve that contract, that says we approve this, correct?
Yes,
That portion.
that's,
Now, the rest of it,
three.
the rest of it, part of our other, their salary portion would
Yes.
be considered approved if we approve it.
If you guys remember, last year, we handled the contract, and then on down the road into this, I guess, right into 2025, we did have to do, they had to do an amendment.
Mhm.
Yep. So we amended that budget.
Yep, their contract just falls, it's at, July to June, so it isn't awkward in our budget.
Any other questions for Mr. Tankers? All right. I will need a motion, gentlemen, to approve this contract.
Motion, contract to approve, presented.
Second.
Motion by Commissioner Adams, second by Commissioner Kurtz. Any discussion, gentlemen? Hearing none. Commissioner Adams?
Yes.
Yes.
Yeah. Yeah.
Thank you. We'll get you a sign, you need a signed copy before you leave, or you want it tomorrow?
Scan
I
tomorrow,
think it's fine.
and everything.
Sounds good.
Thank you.
Appreciate it.
Thank
See
you.
y'all.
Thanks, Chris.
For some reason, we don't see you, Fairly, you and your family, with the new baby. Congratulations.
Thank you.
All right, discuss the Advantage Behavioral Health System 2026 budget request. Evan Miles, Director of Housing and Development.
Nobody from Advantage?
All right, moving on. Well, I guess we need to probably look at it anyway, too. So it looks like, I'm assuming ESP, it really don't look like anything's changing.
No, and they'll present next. So, Susan, I think you talked to Advantage a little bit too about their budget. They're requesting the same amount. They're not changing
They're
their,
not changing their request there. The only thing that was new that they had requested was they were hoping to maybe partner with Madison County with the opioid fund. And I've spoke with Bobby back and forth. We really have not been able to come up with anything that's concrete that Bobby feels comfortable with at this point.
Yeah.
It's kind of complicated and convoluted.
I'm trying to set up a meeting with somebody that can literally give us some foresight into the opioid funds. Several counties have give money, by way of opioid funds, and we're not finding laws to substantiate that, so we're trying to find somebody at the state level that knows what we can and cannot do with those funds.
we've had Zoom meetings with Mike and, Mr. Daniel Haygood. There's just not a lot of regulations out around that, opioid settlement funds, but on this first page in the orange, you can see the funding that we have. And like the chairman said, there's a lot of counties that are they're partnering with programs like Advantage to do outreach.
All right, so we'll cross the opioid bridge when we get there, and literally, we're several meetings probably away. But for now, does anybody have any questions as far as the ESP or the mental health services continuing to get the same amount? Any questions you want me to ask, since there's no one here?
What? What counties are they all supporting? Because on one of the budget sheets here is the prorated percentage of one full-time employee, and that is $30,000.
That's for the opioid fund. That's the additional $50,000 that they're requesting.
Right, but my question still stands, is that?
Is that split between
Yeah,
both
that-
counties, or is that?
I mean, that's, if it's set for 30 and there's 5 of them, are they, is that a $150,000 position? I mean, I'm just trying to understand what.
Where he's saying if they're asking for $30,000 for, payroll, is that just for one, or is that split between 5? Are they gonna need more funding?
Now, are we talking about Advantage?
Yes, their opioid request.
This first page on the back
Okay.
sheet,
Oh, I got you.
On the back page of the first sheet, right?
You know what, I don't know if I printed that page for myself.
It just says prorated percentage of one full-time equivalent position dedicated to implementation of proposed outreach and engagement activities in Madison County. So, price tag for personnel, $30,000, so at a prorated percentage, I would assume they want $30,000 from each particular account. So what,
2 or 3 or 5.
yeah,
And who is not just.
Well, they really never come to
Who
us,
is it?
they haven't come to us and sit down and give us a formal request,
Correct.
because nobody's here, we can't go ask those questions.
Yeah, and I don't know, because I have not had that conversation with them.
But this, it would appear that they're asking Madison County for that much.
well, I mean, the chairman said that he was trying to schedule a meeting and whatnot, I mean, I'm like,
Yeah.
So we also need more information here.
yeah, I think that general practical purposes is.
In addition to the explanation of what those funds can be used for, if this is even a conversation we can have.
And the other part of that, I mean, I'd like to, for my own educational, for that purposes though, is like, what other programs that we have? I mean,
We haven't been doing.
yeah, I mean, I said the Board of Education is doing something with the CHAMP program and the no drugs. And I'm not saying this opioid is not an issue, I'm not saying it's not a problem, I'm just saying, I'd like a bigger picture, understanding of everything.
So for right now, my understanding from opioid use is you can print out pamphlets, you can, hold meetings. The problem is when you go out to a third party to host those meetings and educate the public, we're not sure how we can fund that. And based off of every county we've talked to, everybody has a different opinion of how they read the law as to what you can and can't do. And we've yet to find anybody, including Mike and Mr. Haygood, that can define, is it legal for us to give? Now, we know counties has already give money away. We know counties just give away hundreds of thousands of dollars. This is a multi-million-dollar settlement, and there's really no rules to distribution. So that's scary. But we are trying to.
I mean, the point, the question still stands though, I mean, even if there was a legal mechanism to produce that to a third-party person such as it, man, it's just, what else would we do? I mean, is it needed? Is it warranted?
Yeah. It's broad, but we will try to get you an answer. All right, so moving on from Advantage,
In addition to that, can we have some statistics of what opioid issues look like in the county?
That's all.
opioid statistics.
Yeah.
Can we conjure up some statistics of what opioid issues are like in the county?
Yes.
We've got one person a year, 15, 50.
And Bobby will probably have some
Age
information
groups.
too.
Yeah, Bobby does, he's got a chart, believe it or not, and Elizabeth may know from stuff that she's seen through the health department, but the opioid numbers are sort of low, but the opioid fund is tied to much more than just opioid. It's tied to mental health, it's tied to, counseling. Do you know off the top of your head what all opioid funds is tied to?
That's been a question, I know you brought it up at our last board meeting, and we still,
Still don't need it?
because Jen looked into it, and we've not found any information on it.
Yeah, I mean, it goes as far as equipment. They've stretched it out there for potential stretchers, potential, life-saving mechanisms for monitors on the trucks. Originally it started out as Narcan. It originally started out as this is a Narcan repellent, here's your money, but the problem is you can't buy $200,000 worth of Narcan. So they had to come up with a way to disperse the funds because obviously they need more uses and more educational pamphlets for it. But we'll try to get those for you, Terry. And Derek, 2 questions. Discuss ESP program 2026. Craig Portwood, Executive Director.
Did we do the north?
Oh, we'll skip that one, sir. They're not in attendance.
Okay.
Yes, sir, come on.
Good evening, how are you?
Good, thank you.
Appreciate the opportunity to come share a little bit. I'm hoping you're, with your 14 consecutive years of support, familiar with ESP and who we are, but obviously we exist to create transformative experiences for people with disabilities and their families. And we believe that changes communities for the better. And coming up on our 40th year at ESP Athens, based in Watkinsville, that's serving 9 counties all around us. Just finished our largest, hottest summer camp ever. 6 weeks of day camp, 2 weeks of overnight, serving over 500 unique participants. We have the pleasure of serving 60 different families that reside in Madison County. And I just looked at our summer data. Had 24 of those participants that attended at least 1 week of summer camp with us. That comes at a cost of $1,000 per week. One of the things that we're firmly committed to at ESP is that we only charge families 25% of the actual cost of a program to put it on. As I like to tell people, math is still math. It still costs 100%. So that gives us the opportunity to partner with places like Madison County to help fund that for some of the residents that take place. We have, again, a delightful partnership. We work very much hand in hand with the Madison County school system, who bring buses to us every day during summer camp, which of course employs bus drivers for Madison County, but also means that residents here have a ride to ESP on a consistent basis, and then they're with us all day long doing field trips. And it's pretty remarkable to watch the family involvement. We have many more than those 24 that will be engaged over the course of the year in what we call our 360 afternoon programming, our wraparound programming. One of the other key things that we're able to provide is family support and respite for families. I could tell you countless stories of families that come up with tears in their eyes after overnight camp of it's a vacation that a mom and dad have taken for the first time in 12 years. The first time they've been able to get away or to just go to the doctor's office, clean their house, have lunch with a friend, because we're able to provide those unique experiences for their participants. We have no age limits at ESP, which is one of the reasons we keep growing. So Madison County residents that were at camp started at age 4. The oldest participant was 55. Once you're part of ESP, you can be part of ESP forever. Anecdotally, not a Madison County resident, but had a young man that celebrated his 35th birthday with us at overnight camp. He started when he was 5 years old. And continues to be part of this community that he is deeply ingrained in. So this is where the layers upon layers continue to add up, and we just keep growing. My phone rings every day with families looking for a place to connect. So we do just respectfully request $25,000 to help fund some of those programs, and I'll be glad to answer any questions you might have.
Okay, so I got a question in this. I think ESP is great in this, but how can we fund ESP when we got questions about funding other folks? Is that like a governmental agency? How does that become okay for the county to fund?
I don't know the legal answer to that avenue. I don't have an answer for that.
Yeah, I'm not trying to cause any issues,
Yeah.
but that's just contracted services.
It have to be.
Yeah.
We cannot contribute.
Right.
Yeah, so do we have a contract then?
Do we have a?
It's started way
I
before
don't
we
know
all
that.
did.
They're waiting for me.
Yeah, I mean, I'm just coming up, and I'm not trying to create stuff, but considering that we're getting deep into this with other agencies.
Sure.
That's something we need to think about as we move forward. We may need to get something more written up or whatever, and we might want to get to Mike and just make sure that there's not going to be any issues as we go through here and we tell some folks, well, we can't give you money because we don't want to have, we would like to have those issues taken care of. And, but ESP, I mean, I'm very familiar with it, and I think y'all do a great job, and we appreciate it.
We appreciate you. A long time history of support has definitely been very, very much enjoyed.
Yeah, I got to concur with Commissioner Kirk. I love ESP, what they do, the employment opportunities, the coffee trucks. I mean, it's just good. There's no way around it. When you look at it, it's just good. I do concur with him, though. We have put through some of the people in this room through the ringer with meeting contracts. If you happen to have the original, we'd just like to read it, because nobody at this table was here when this started.
Right.
So if we can just get it, because it may need to be updated. It may be something that we need to change the bar from where it originally was to where it's at currently, so you have a current contract. So yes, 100% concur with him, and thank you again for everything you do for us. But see if you can't get us that. Do you have our email contact?
I have, yes.
Okay, perfect.
Perfect.
All right, thank
Thank
you.
you.
Any other questions?
I'm just thinking out loud, I mean, could be, again, contract service to the rec department, or, you know, something to go over agreement with the school board. I mean, there could be a variety of ways that may exist. I'm not saying they do, I'm just saying that there's possibilities.
If you can research it and just sort of see what the connection, if there one exists, and if not, maybe we need to just make sure that one.
My supposition, again, not having lived in here a couple of years, but since this did start 14 years ago, my guess is that there probably wasn't a whole lot in terms of a firm written contract. It was more of a, you're servicing our residents, we would love to support that, how can we do that? But if that leads us to how can we do something a little more formalized, knowing our partnership, especially with the school board, I mean, working with transportation in the summer, looking at those residents, there may be something we can do.
And it may be already with the school board, I don't know.
Right.
And if it is, I guess we can do something.
Well, I'll reach out to our contact with transportation and just see what, I mean, I think it may just be an agreement for the summer services, but there may be a way to build off of that.
Absolutely. We want some, we're trying to get a concrete profile.
Absolutely.
And we've struggled for 4 years to build those slowly, but we're getting there. But thank you again. Any other questions or comments?
Just, it could be good to reach out to our Board of Education, see if what they have existing with PSP.
Sure.
Yeah.
And I'll do some research on our end. Is there a suspense date that would work well for this board?
Honestly, if you will just, if you find something, just contact us. If you don't find something, contact us, and we'll get our attorneys to start writing one.
Perfect.
We'll probably need to have some contact between you and him so you can explain what the contract needs to read like, or we can use a different one, to possibly go off of.
Okay.
But we just want to solidify the future.
100%.
Because I don't think anybody's in an argument about what we get. It's
Right.
just how we get it.
Absolutely.
But so that we have sort of, maybe some of these put together, what is a good date? I mean, I don't know how far out, do we know, Christina or Susan, what we ought to have it back by?
Do what now?
A contract date.
Contract date.
Not to have, to understand for him to make sure we get back to it. I mean, when would we really need something that, if we wrapped it
I don't
up?
think that we have to put a deadline date on it. I think that he's been really great for me emailing with as far as communication. I think as long as we just continue to communicate and move forward, then we can bring Mike involved, and between Mike and Daniel, they'll probably have one.
Yep.
So it shouldn't take too long to get that taken care of.
How many surrounding counties do y'all serve?
We serve 9 counties just in this location. Of course, some of those populations will be greater. I mean, obviously Athens, Clark, Coney County, because people are located right there. But we'll even have some folks that come down from Gwinnett, especially during the summer. They want to be part of the programming that's offered. Because we do have a location in Marietta, but when you're in Gwinnett, you don't want to go through Atlanta. So they tend to drive down here. We had one mom that they lived in Tequila, and we were driving 45 minutes, and she just sit in the parking lot while her son took part in our programming, until they finally said, that's too far. They sold their house and moved closer, just so they could be near ESP.
Well, which is a thought. If you can, whenever you communicate, if you can put up sort of a number of maybe Madison County residents that have been served, or that we're serving currently, or whatever.
Absolutely.
Just something that, so our community knows.
I know that we have over 60 families in Madison County that at some point in time received services from us, and that's 24 that got some summer camp this past summer.
Okay.
So there's 24, and that's at least 1 week. So at $1,000 a week, if they got 2 or 3 weeks, then that creates a $35,000 to $40,000 worth of services provided just for Madison County residents.
Very good.
So,
Thank you, sir.
thank you, Jim. Appreciate it very much.
Thank you very much.
Thanks.
Thank you.
Thank you, Commissioner Kirk, for bringing that up, because we thought we do need to look at that. Discuss Madison County Health Department 2026 budget request from Elizabeth Allen, County Nurse Manager.
And I've got Emily Eisman here, she's our district administrator. Hi. She's gonna present the budget piece, and I'm gonna talk numbers. And other.
Hi, Emily.
Hi. So, you all have this budget that's up on the screen. This is our first time presenting here to the Madison County Commission, so I'm not sure how much detail you'd like me to get in. Bottom line, we get funding from a lot of different agencies. Our primary funding is through the state. We get almost $500,000 from the state. Our annual budget is about $1 million, so we get about half of our funding from the state. We do collect fees, we bill insurance, patient fees, and environmental health for restaurant inspections, septic tanks. So we do a good job of collecting our own fees as well. We also have several pass-through programs. Family planning and WIC are the largest, and then contracts is a bunch of other little programs that are funded from various state departments or federal, and they go through the district office and then are dispersed out to the individual health departments. We are requesting funding in the amount of $175,000 for county funding, a slight increase over what we've asked for the past many, many years. We just are having some continued increase in expenses, utilities, travel expenses, that sort of thing, mileage. So I'm asking for just a very small increase in the amount of about $16,000 more than the previous year. So asking for $175,000. As you can see, the bulk of our expenses are salaries. 70% are salaries, and the rest go down from there, pharmaceuticals, other things to run the health department. So now, Elizabeth has a lot of information on the number of visits, number of patients, and things like that she can pass out for you.
Yeah, so y'all already got copies of everything. This top packet is our annual fiscal report from FY 24-25. These are the numbers that are solidified and ended in June. So it just kind of shows you a breakdown of the services that we offer, as well as the percent of residents who reside in Madison County that we do service. And then the second page, the one-pager front and back, gives you percentages at a different kind of scale so you can see it better and kind of pull out that data to view it. So we do like immunizations, family planning, we do child health services and screenings for the schools. We do TB testing and treatment, STD cancer screening, which is mammograms. We do have a program that pays for mammograms for those who cannot afford that, as well as other diagnostic testing and mammograms, as well as biopsies if they need those. We do pap smears, we do outreach events, we do cardiovascular wellness, so patients can learn their numbers. We've screened lots of people, and we've also found many of those who have diabetes, high blood pressure, and they need treatment, and that's something we also offer at the clinic as well. So you'll see that one on here. You can see how many visits for outreach that we've done, family planning visits. We've done 652 visits. About 400 of those were patients and that have returned throughout that year, of course. Immunizations, we've done 495 immunizations for people in our community. We've done 121 child health referrals. So this is where we have a program that goes out to homes who have high-risk children, infants, babies, and they do assessments, and based on their risk, we do referrals and get them into just resources that will help their babies, survive and thrive. So we've done 121 of those in our county, the vaccines, the WIC visits, and then on the back you can see environmental health, and obviously our county is booming and growing, so we have definitely increased our septic permits, inspections, and we're a one-man band over there in our environmental health department, but he's rocking. So
in environmental health, of course, there are fees that the county has approved for restaurants, septic tanks, that sort of thing. All the health department services are on a sliding scale, which slides to zero. If people do not have an ability to pay, there's no charge for our services. And I know you're going to ask about a contract, but we actually operate under Georgia code for close to 100 years now. So there can't be a contract because it's just state code that each county supports the public health. So I thought I'd just preemptively go ahead and tell you all that. So I've been asked before.
We've looked for them and we found a lease. I think I've emailed with Elizabeth. We found a lease for the building.
When we have WIC over at the other place, but not at the health funding and a building suitable for a health department are required by state code.
Yes, ma'am.
Yes.
That's true. Any questions about budgetary?
Yeah, don't start.
I'm going to wait till we get to the budget. I was going to segue right into that, but I'll let them.
On your contract provisions on this sheet right here, it looks like what's impending doom there? It looks like it's about a $40,000.
Yes, I'm going to have to refresh my memory. That is probably COVID funds primarily that are no longer, okay, those were passed through. Any COVID activity, all different kinds of programs fall under that contract line. They're not large enough to break out. But COVID, we have the mammogram program that Elizabeth mentioned. When we do TB work, all those sort of things, the health department tracks what they do, and then the programs that have state funding, we pay the health department back for doing those visits. Okay. So when the COVID money went away, though, there's no more money to give the health department for COVID activities because the COVID funding, as you're all probably aware, was stopped. So that would be the bulk, is good part of that. So, of course, we are billing more than we used to, and we feel like we should be making that up pretty well.
Or the equipment needs that you have.
Yeah, I think equipment probably went, let's see, computer refreshes all the way around for you guys, new desktop computers for them. They're about eight or 900 each. That would be that.
Windows, upgrade our windows, and then just regular maintenance.
Right.
Computers, monitors.
Oh, you said Windows, you mean Windows software?
Yes, the software update.
I just thought we meant to a maintenance line item.
No,
Okay.
sorry.
I'll be remiss if I don't ask you, when you were naming off the things that you do, I always ask you the same thing in the health department meetings. We wasn't the first in the state to do it, but you were really close to being first in the state to start administering.
Next one.
Oh, yeah, I was first.
Yes.
It was
Very competitive, but yes, we do,
Explain that to the
the
board.
state of Georgia, probably in 2022, started a new initiative. We're the first state in the United States to train registered nurses, specifically public health registered nurses, to do procedures, which would be the Nexplanon implant. That's a birth control method that goes under the skin in the arm, and it lasts for 3 to 5 years. And we were the first state to pilot this program with CPH, and I was one of the first in the cohort to be trained on that, and then I currently lead the state in insertion, and that's basically from Madison County.
Yeah, it's for Madison County, yeah.
But I only service Madison County.
Yeah.
But number one.
Let me clarify, not the biggest county, see, but the most
Takes a lot of work.
Nexplanons in arms, apparently.
Yeah, but
But
again.
it's a big deal. I mean, and we've had so many other districts in the state who have started this pilot program and initiative as well. And it helps people choose their family planning, and that's a big deal.
See, previously, these had to be administered by nurse practitioners or higher, and that's obviously a very expensive staff person. So to allow registered nurses to do them, and our registered nurses do a lot more than a nurse in a doctor's office. We work under protocol, and they're called expanded role nurses, and they can do a lot. Nexplanon was even a whole nother level, but our nurses in the health departments are performing the same services that medical doctors do in a doctor's office, within the limits that we do.
Pap smears, blood pressure, hypertension, prescriptions, prescribing meds, and all the things like that.
You knew I was gonna bring that up, because I'm proud of it. You know.
We're proud
It's
of
a
it.
big deal. I mean, it's a big deal.
Yeah, we're
It
very
is
proud.
what the state it is, for sure.
All right, so, yeah,
So Emily, I have one question for
Yeah.
you, because we'd started at 175 when I dropped these numbers in, and Christy had emailed me and was stating that there was a possibility they may have to ask for another 20, so I had made a note, but when you were speaking, you said 175.
The 175, yeah.
is what we're
I think the
gonna-
confusion might be because that's about 20 more than where we were at.
Okay.
That's
Okay.
fine.
All right, that's fine.
Very close.
yeah, it was 20 over the original question, which would have been 178,732.
I like round numbers. I don't know how it ever got to be 158,732, but
It's been like that for at least 8 years.
Yeah.
I don't know
We've
where
not
the,
asked for an increase.
I don't know where the $732 came from ever. It's an odd amount, but.
All right, any questions, gentlemen?
And I'm glad you went ahead and explained that, so I'm not asking that question about it.
Well, I learned from, the previous
But that's
presentation.
good to know, and, because people want to know, why does my money, it's my money, tax money,
Yes.
where does it go? Why am we paying that,
That's right.
And I'm telling them, well,
Yeah.
you need to check with the state. The reason the state says we got to.
Public health is in a little different, situation, I think, than a lot of other agencies.
For the good of the health.
Oh, yeah.
You know, health of the.
So you're the regional director?
I'm the district
District
administrator.
director.
Yes.
Mr. Administrator.
Mm-hmm.
So where would you say Miss Elizabeth or Miss Allen ranks amongst the rest of your district? Where does Madison County stand as far as DPH goes?
In what?
In what metric?
Services.
Services, well, I mean, this isn't the largest county. I mean, they don't see more people here, but they do put in more Nexplanons than anybody, so that's a really amazing feat, really.
Well, Elizabeth knows what I think about the health department. Obviously, I have to share that for her too, but I think we have a phenomenal health department. So I was hoping you was gonna tell me that we're the number one in the state.
Oh, well, in my eyes, you're the number one. Well, I can speak to this district. Elizabeth is my favorite Madison district.
That's a lot.
Does that work? That says a lot.
It really does. If you knew Emily, that's a lot.
Are there services that you wished you could provide that financially you're impeded from doing that?
Based on our protocols that we get with the state, no. All the protocols that
So
I'm
we're
able to
covering
provide,
everything we
I
can.
provide every single one of these on this paper. And I have another nurse, and then I have a float nurse that comes out twice a week as well.
Is that so?
I'm sorry?
Who's your other nurses?
She comes from Clark County, so she's a nurse that's housed in Clark County, and she floats out to Madison Tuesdays and Wednesdays to provide additional support.
You have another full-time.
And we have another full-time nurse, yes, sir. Kelsey Osley.
He just touched on something I was gonna ask. You all also work with our EMS as far as the blood deal. Don't y'all rotate blood out back and forth if need be? You know, we keep blood on the trucks now.
We do not.
I think that.
That goes straight, that's the hospital.
Yeah.
All right, it was turned over to the hospital. I was thinking y'all were able to use it if we didn't turn it over fast enough. Okay.
No, I remember that presentation, because they monitor it and they work with the hospital, so if it gets a little bit of age on it, they swap it out so it can be used immediately.
All right, well, thank you.
All right, another thing is our building.
Yes.
That's been here since the early 2000s, and as most are fully aware, it's built on a dump. We've had numerous issues with settling. So in 2014, Ramjack came out, jacked us up, and in 2021, they came out, or 2020, they came out and jacked us up again, and then we're settling again. Ramjack's come out also and did other assessments. We're having structural issues, unlevel floors, we're having pipes that are pulling apart at this point, and Ramjack basically says they can't really do anything else except for a substantial cost. I should say that, and honestly, they don't want to do work there because it is built on the dump. But this brings up a question of what kind of plan do we want to have for this building, because I don't see us lasting there much longer, just with the structural issues as well as the pipes pulling apart.
And, you know, we've spent money trying to make it look better so that there aren't cracks in the floors, people falling over and stuff. And we spend the money and then it just has been cracking again. Honestly, it is falling into the earth. And, you know, we had a study done and the soil's just not suitable for a building. That's what the engineers say.
We know what square footage that facility is.
Square
We know what
footage.
square footage of that facility.
Paul, do you know what the square footage of the health department is?
2,800.
2,800.
2,800? 28?
Yeah, that's what they measured.
Yeah, I knew it was around 3,000, I wasn't sure exactly.
And that's another reason why Paul is here tonight to speak on this building. He has worked with, I know Elizabeth and Emily, and he has met with Ramjack, he has called them. I think he's talked to Derek, one of some people, other companies, and reached out to them as well. So, if y'all have any structural questions, Paul can answer those too, he's very familiar.
Somehow, when Ramjack come out in 2020, if I'm not mistaken, Paul, clarify me, or correct me, when they done the jack up then, they wasn't aware that it was built on an old landfill. So they deemed since it's been determined it's on an old landfill, now they won't warranty it.
So that
Nor will they
lifetime
do any
warranty
further
didn't last,
work
huh?
on
Okay.
it. So I think that's where we're at now, Paul, or was you able to get another quote back, buddy?
Yeah, I spoke with the owner of Ramjack, and, he said he had received false information through the people in 2014 or something, when the attorneys were going back and forth. I don't remember the year on that one, Christina, but, that's when they first learned, that it was on a dump, because they had their first bore, they hit bark and tree at 7 feet, and then they penetrated that and came back up and pulled out trash. So that's when they deemed that they weren't gonna, they still tried to fix it, but they wouldn't warranty it.
Currently, how many bathroom drains is pulled apart that we can't fix because they're under the slab?
All the floor drains.
All the floor drains?
All the floor drains are disconnected from the slab. To the best of my knowledge, I can't fit under there, but to the best of my knowledge, all the sanitary lines are still connected.
For now.
All right. Thank you for the update, and Paul, thank you, because I know you've been doing a lot behind the scenes. I know Christina's worked with you, Alan's worked with you, you've worked with everybody, but thank you, and we'll take note of this, and we'll try to find some resolve rather quickly. And I want to make the board aware, I think you guys spent about 175
Yeah.
in 2023 with a complete interior remodel.
Yeah, well, because at that point, Ramjack thought, okay, it's good now, and it stayed for a bit, and then,
Because that was funds we put back for the past couple of years too, but then when the floor started, our wet mamas were walking across it, so we had to fix it.
And for clarity, the state has no more funds allocated to go towards a new building, or is there?
no, this is under that same code. The county is required to provide a building,
Yeah.
a habitable building for the health department.
I was hoping you'd say, well, we might be able to match something, but that's okay.
We've looked, we've done, we really have. Okay.
Yeah.
So
Thank you.
let me clarify this thing. When you say that y'all spend $175 working on the building, you meant the taxpayers in Madison County?
No, this is funds that we have gotten in. This is not county funds.
Not
None of
county
this
funds.
was county funds at all.
Where'd that money come?
This is prior year funds that we put back in our fund balance that we had, that was extra from our billables.
Okay.
Because we work under budget a lot. We really try to work under budget. We're very frugal with what we do. We don't
I'm thinking
just
about,
spend it and spend it,
okay.
The county funding is about 15% of our budget, and all the other fund sources, are more flexible funding for repairs and maintenance and things like that. State funds.
We're holding out.
Yeah, we held it back.
Mm-hmm.
Expecting when it stopped sinking into the earth, one nice redo and we'd be good to go, but it didn't work out. It sunk again.
Thank you.
Appreciate it, thank you. And good job. I know you was worried about what to present, but good job. Y'all both did a great job.
Okay,
We want to
thank you.
hear from you quarterly.
Okay.
Just an update on things like this.
Okay, we can do that, for sure.
Well, that's true. I like the infographics. We'll bring those to the Board of Health meeting.
Don't make it no longer than it's gotta be. No.
You can say less in more and less time with that infographic, don't you think?
Right?
All right, we'll see you Thursday at the meeting.
This Thursday?
Yes, day after tomorrow. 2 days. Thank you.
Question about that building, sewer section.
It is on sewer.
Does it have its own pump station?
It gravity down to the jail, the pump station. Because the jail pump station is literally straight out the back door, down the hill at the bottom.
I'm pretty sure I know where that's at, I put it in.
All right. They do a great job over there. Discuss Madison Overthorpe, Animal Shelter 2026, Mr. Steve Ledford. Thank you, Paul. Thank you, Ms. Metz, for letting me come.
Just take me to dinner now.
Hi there. And have to talk to you. One thing I will say, we're one of those folks who make things hard by having a fiscal year that goes up July through January. I talked with our accountant about that. I have to do a whole lot of work with the IRS. Maybe we'll do it, but I can't do it yet. So anyway, also, since contracts seem to be the issue of the evening, we did ours last year. Thank you so much for that. It ended up very well, and so there's nothing to do there. And want to just do a little bit of an overview of how things have been, and then talk about anything you want to on the budget. Is the budget up there? Yeah, it is. Okay. Last year when I talked to you, Glenda and I came and talked to you, we were in not great shape. We were losing about $100,000 a year, and we only had $40,000 in the bank. And so we knew we had to do some stuff. We talked with you. Some of the things we promised were we were going to make some pretty, we were going to make some changes to our cost, that type of thing. We said we would cut payroll 5%, I think it was, 10% on supplies. I'm happy to tell you we were able to actually overshoot that payroll. We were able to hold back about 12%. Part of that was because we had some management turnover, which I know you're aware of. But on the supplies, we were able to reduce it about 30%. Both of those revolved largely just because of just tighter operational control. We just needed to do some better management of some things, and we put some things in place. We're able to do that. It's sustainable, and so we're going to continue with that kind of fiscal discipline. We're looking for other areas. One of the things, the additional funding from both Madison County and Oglethorpe County has helped. Just because it was split over just half of the year, the impact was about $15,000 for this year, last year. But it actually is on more of about a $30,000 to $40,000 increase ongoing. What I use for the budget, by the way, because our contract is based on inflation through, it's actually November is when it is. I put in a number just based on the previous year, and we'll have to figure out that when it comes, but it shouldn't be a whole lot different. If I could actually predict inflation between now and November, I'd be a whole lot better off, but anyway.
You wouldn't be doing this.
So anyway, those are some of the things. We have also done some things operationally. As you know, we, in fact, when we were talking last time, we were actually in the middle of a shutdown because of some issues with the Georgia Department of Agriculture. We have put in place a much stricter regime. By the way, we just changed the way we manage a lot of things because we needed to. And so we did reduce our overall budget deficit by 95%. We still ended up with about a $5,000 deficit, but we're actually, the last couple of months, the last few months, in fact, we've actually been in positive territory, and we think we can continue that. And some of the things we're doing. So that's what we've been doing. One of the other things, and this is more just looking forward into the next year, we're going to continue with the fiscal discipline. We're going to find ways of expanding our service without having to go to some of the traditional sources for more money. So what we've done is we have three things that, by the way, the one downside financially, adoptions were down. A lot of that was because when you're closed for 9 weeks, people can't come in and adopt. But we also found some things with our adoption process that were getting in the way. And so we're working on that as well. So hopefully that'll come back. But we actually were down $43,000 in adoption fees. With that, though, with the other things we saved, we also had an increase in donations. We actually ended up much better off this year. We're looking at three things going forward next year to address some of our biggest issues. I think, and you actually last year said we need to work our way out of a job. Was that you? Okay. Or you? Okay, yeah. We need to work our way out of a job. Spaying and neutering is one of our main jobs. What we've done is figured out that the main issue with spaying, honestly, is in order to adopt out dogs, we have about 1,500 dogs and cats come in every year. In order to adopt them out, they need to be spayed and neutered. We actually have a good bit of funding for spaying and neutered pets that folks own and bring in, to help with that, especially low-income folks. But we have this backlog, and so we found a donor who was willing to fund us to spay and neuter dogs and cats when they first come in, so we can adopt them out more quickly. So it actually helps us out in a lot of ways. That's going to help us. We have brought on. We were working with a variety of different vets. We now have a couple of main vets And we're now able to cover every single day of the week. So we can actually do surgeries every day of the week now. That increases our capacity, and so we can get more spaying of dogs done. Cats are a different matter. The issue with cats are always a different matter. I'm married to a cat lady, so, and cats are a different matter. Cats, the big issue are what they call community cat colonies, which are basically either feral or they might have just been strayed, but they're now living away from their owners. The issue with that is just say, bring your cat in to get spayed, doesn't work. You need to go out and get them. And we have another very generous donor who is going to spay us, having a more formal, basically spaying and neutering of community cat program. We're actually working with folks like Fixed Door to Pets, Cat and Zip Alliance, folks like that to help us learn how to do this well, and we have funding to do it the right way. So that should actually help with the overall problem with those dogs who typically are owned. It's just whether folks bring them in and spay or neuter. We'll be adding education and stuff like that as well. But so we're dealing with that way. The adoption is another issue, and one of the issues is we're just a couple of miles down the way, but it's not like we're in a mall or something where people are walking by all the time saying, see the cute puppy. We have to get people there. And so we have another generous donor who has donated $25,000 to sponsor basically an entire upgrade of our adoption program around three things. One, making it where the puppy room, which is where folks can go and play with the puppies, it's not really good right now. We're going to redo that. They're funding it. We're also going to be doing things like having special events where we're going to be advertising that type of thing to bring folks in and have volunteers who can help guide people through the process. So it's not just coming in and looking at dogs saying, what do you want? It's someone to help them because we know we need to increase adoptions. Right now, what keeps us from having to, have an increased euthanasia rate is we ship a lot up north. I'd like to be able to take care of more of the problem at home. And so that's one of the things we're looking at. The thing about all three of those are these are not dipping into the funds that we are already getting from counties, generous donors, and some of our clinic fees and such. This is all newly funded by donors who realize we have a problem, and they're helping us get there. So that's really the story of what we plan to be doing. And there's our budget. Anyway, we have a budget we sent you earlier.
Yeah.
Some of the things you'll probably notice, we are actually looking to increase our revenues this coming year. One of them is increasing adoption fees. The other is clinical services. So that's really the spaying and neutering, which either through funded spays and neuters or folks coming in, we can handle more of them, schedule them more quickly now that we have more capacity. And so that will help us with that part of it. And the other thing is we are planning on increasing our donations. Part of it, some of the things I just talked with you about, working one-on-one with specific donors on specific problems. We also have a membership program that we're in the process of revitalizing right now, which we think will help out as well. So those are some of the highlights, but any questions you might have, happy to answer.
In years past, there's been, well, first off, thank you. Because y'all have done, 3 weeks ago when you sent that, or 4 weeks ago when you sent this over, I was completely shocked at the numbers and the turnaround, the difference y'all made in such a short period of time. I mean, you guys really buckled down and done some really hard work to get you to where you're at today, and I thank you for it.
Thank you.
And matter of fact, that was so well spoken, I almost want to go adopt an animal and give it to Frank May.
Please do.
But yeah, man, good job. I mean, really, really good job. And thank you for putting that outreach program out there and being able to get those donations. So my question is are you having a much better relationship now with Oglethorpe County? I mean, I knew we were all pulling the wagon in the same direction. It just seemed to get miscommunicated a lot. But.
Absolutely. Yeah, in fact, I presented to, this fiscal year, presented to Oglethorpe County last year, a lot of the same things we just talked about, but no, it's been much better. We are now handling dogs that are being brought over by the sheriff's office. In fact, I saw some of them just today when I was in the shelter. And we're finding homes for them. It's working out very well. At first, we had to work out exactly how the mechanics work. It's like, don't come in the front door and wait in line. We have a side door. We know who you are. You have a fancy car with lights on it, so you can come in that way and bring them. And
There
so,
were some revenue increases in that also. I know.
Yes,
I know
exactly.
People are willing to pay for these extra services, so that's really good.
absolutely. No, this has been fantastic. One other thing, by the way, you talked with us about credit card fees last time. We're changing our credit card process, and we've already reduced our fees a lot, and we're moving things over so that we should not be paying any more credit card fees. And so,
Just a good job.
Yeah. Seems like I heard that, I guess this is maybe one of your efforts, but did y'all actually, I guess, work with somebody that had some event and y'all took your dogs for,
oh, yeah.
I took it that it was not in Madison County, it was
No, it
somewhere
was-
else, which makes sense, you gotta go where the folks are that's gonna adopt them.
Well, and I was the one who put that one together accidentally. By the way, y'all should, I'm the numbers guy. I'm not necessarily the one that does a lot of the animal stuff. So this was new to me. But I was going over to Bulldog Kia to beg for money for, because that's what I do. And they say, well, we'll do you one better. Do you want to adopt out some dogs? And they have a promotion they do every year called Dog Days Summer Festival. And so what we did was we took some dogs over. Some of them got adopted, and so we were able to, and we actually do these events. Problem is, you can only take a handful of dogs there if you want to bring folks in, so, but that's right. Yeah. And they also gave us a portion of their sales for the entire month of June as a donation.
Oh, right.
So,
That's thinking outside.
Yeah, that's good.
no, but they were the ones that suggested it, so, yeah, appreciate it.
Yeah.
We'll go to Clark County to get money if we need to.
Yeah, that's good.
People of Madison County says thank you.
We spend enough in Clark County, I think we should need some of it back.
Any discussion or any questions, gentlemen? Any suggestions?
We have a lot of cats right now, anybody want them?
Frank Davis.
Frank, I brought 3 up there together.
Oh, thank you.
Do y'all go to like pet stores and, or not like pet stores, but like a.
Like a Pet Supply Plus or Pet Smart or what?
Yeah. Do y'all do those kind of, I know out at the Kroger on 29,
Yeah.
somebody used to take dogs out there every other week.
Yeah, the ones who take them out there, I believe that's Athens area municipality. Yeah, the pet supply places are, right, we have done that in the past. Right now, they're kind of staked out. It's almost like a turf kind of thing. We go to the Tractor Supply, and we've had some good luck at Tractor Supply. Actually, the one in Commerce more so than the one over off Lexington Highway. But we've done that. But no, that's, I'm learning this fascinating world out there. But no, most of them are staked out, but we have our eye on those.
There'll be a new Tractor Supply behind the Dairy Queen at Kroger, so.
I heard of that, yeah.
Put your stakes up there.
Okay, yeah. Yeah.
Gentlemen, anything else?
Not that y'all haven't thought about it, I know I mentioned it several years ago, and I forget the executive director at the time, but, I still think, that swath of land that goes down the driveway, somehow creating, under the power lines and all, where you can't build anything anyway, some sort of dog park, some sort of, run, you can rent out, bring your dog,
Yeah.
I know it takes money, I know it
Yeah.
takes expense, but like, when you're working with Tractor Supply or other companies like that, I know it's a specialized kind of design, I've seen them, I've done some of them. And, but I really think that is a way to pull in people, because not everybody's got a big yard to let their, and it can be a social event sometimes.
This is a good point, because first of all, we do have rights to, that is considered part of our property, so you're right on that. We've had an issue, like how do we make the best of our physical facility, because it can be a little cramped in there, honestly. That would be a good way of getting, spreading out, basically, is what it could be. Someone came to talk to us today who's very interested in helping us out, and one of the things they said was finding grants to help us expand the use of our property, facilities, and all that. So that could be, this might be a chance to do something like that, so.
We're talking about foot traffic, so,
Oh, yeah, yeah.
You bring Johnny and little Sally wants to go look at the cats, whatever.
Yeah, I envy that cat cafe over in Watkinsville, because they moved some cats, and we need to move cats. So, but no, you get people need to see them,
Talk to Purina and Hartwell, maybe you can get
some kind of sponsorship there.
Yeah. Good
Since
point.
they're so close by.
Yeah.
Anything else? Christina? Yeah.
I just wanted to let you know, tell your staff, thank you, that they do a great job with working with our animal control stuff, and I know that our staff really appreciates that relationship that we've built together, so.
We do too. And the good thing is we're close enough that we can work well together too. So, yeah, thank you. I will let Julie and the crew know.
Yes, thank you.
They do a good job. They do. Thank you.
Thank you.
Discuss Madison County Department of Family and Children's Services 2026 budget request and accountability. While you're coming up, they have done an about face over there. Wow. Good job. You might be back on track now, right?
Yes, I hope so.
There you go.
Don't say that too loud, because you know, in our world of things, that can change very quickly. So that's just the first packet in the information, is just kind of all the data for 2024. The first is the org chart. So I have 5 full-time case managers, which is the most I've had since I've been there. Two are in training. I have 3 certified. I just recently, actually, after I submitted my budget request, was able to get approval to hire a state-funded technician to help staff. We have done interviews and we're in the process of moving to hire a candidate on that position. So right now, the only vacant position I have is my supervisor position. I'm the county director and I have an administrative assistant, Ms. Bond. The first page is just the new cases that we received in 2024. The blue line represents CPS, which is our investigations and family support cases. So that's like the intakes we've received. The orange line is our family preservation cases. That's where we've substantiated abuse or neglect, but the children will remain in the home. And then the green line is foster care. Foster care did see a spike in August. We usually do see a spike in everything in August, just because school goes back. There's more eyes on the children, more reports, that sort of thing. The next page is a correlation between 2023 and 2024. And for the first few months, I did add 25 data. You'll see that our CPS and family support cases increased for at least 9 months in 24 from the previous 23. So we had a total of 162 CPS cases in 23 and then a total of 218 in 24. The next page shows our screen out and refers. What that is, that means someone has called and made an intake report to our hotline, and we've decided, the call center has decided that there's no need to respond, but there's no need to respond in person, but we can call and offer services, see how we can help them by phone. Those numbers have decreased from 23 to 24. So that means that we are actually responding to more cases as opposed to screening them out and not responding. Page 7 is our active totals in family preservation. Again, that program area is where it has been substantiated abuse or neglect, but the parents maintain custody of the children. We're just working with them long-term to get them services, get them set up in whatever they need. And it almost doubled. So in 23, we only had 18 cases total, and in 24, we had 32. So on the next page is our foster care entries. It actually decreased. So in 23, we had 38 children that entered foster care, and in 24, we had 17. I think this kind of correlates with the family preservation, so we're not removing as many kids, but we are working more with the families prior to removing them, providing them services, maintaining children in the home, which is kind of what we want to do. Then the next page is our foster care exit. So we had 24 children that left foster care in 23, and we had 12 children that left in 24. So there was kind of a decrease there in our numbers. And then the next
Leaving meaning being adopted or aging out.
That's the next page. The next page is the type of foster care exit. So we had 8 children that were reunified with their parents. So the parents worked a case plan and got the children back. We had 3 that went into the guardianship of a relative or a fictive kin placement. We had 1 child that turned 18 and signed themselves out, and we had 1 adoption. That was in 24. The next page is our voluntary kinship. A voluntary kinship is, that coincides with our family preservation program. That is where we have decided that there is enough of concern that the child needs to be out of the home, but custody does not need to be removed. So they're usually placed with a relative or a fictive kin, someone that has a relationship with the child. The child will stay there while the parents fix the issues that have brought about the concerns. So we had 3 in 2023, and in 2024 we had 8. So we're utilizing that a little more than foster care. And then the next page is our current reimbursements. It's kind of everything, it's a pie chart about everything that we've spent the money on. A couple of things are self-explanatory. Our pack and plays. One thing about the pack and plays, that pack and plays for families that we are working with. It's not for foster children. There's a separate pot of money. The state reimburses our foster parents. So this is, say like we had a kid that we placed in a voluntary kinship with the grandmother, and she needed a pack and play, so we would use some of the county funds to buy a pack and play so that the child would have a safe place to sleep. The community events includes just events that my staff has attended to recruit foster parents. Currently, we have 3 foster parents in Madison County that's approved. The incidentals covers everything from haircuts, allowance. Sometimes we have to pay for daycare before the CAPS process starts for foster children. That can take a couple weeks. Extracurricular activities, field trips. One thing in that pot of money is we were able to, in 24, we paid for one of the foster children to go on a school trip for spring break. He went to Washington, D.C. and New York with, his foster parent paid for his ticket and went with them, but he went with his class trip because it was an 8th grade class trip, and so he got to go. That was almost $2,200. I think it was $2,199. So he was very excited about that. And he worked very hard. The deal was he had to go to school every day, he had to be passing, he had to be eligible for the field trip, and it was paid for, and he was very grateful and went to school every day and passed all his classes. So that was a nice incentive for him. And then the next one, it's just broken down what was spent on foster children, what was spent in the community, salary supplements, and then how much our board was given. The next page is the budget request. So previous budgets, we requested $33,500. I did ask for an increase of $45,000. Since I did let y'all know, we will not be using any of the funds for the tech. One of the board members, one of my DFACS board members she's the Director of Action Incorporated, Margot Fowler, and her and I have been talking. Her budget for heat, energy assistance, and rental/mortgage assistance was cut 53% this year. for the following year. And her budget also covers 10 counties, Madison County being one. So what I would like to do with the additional funds is open up a pot of money called general assistance. My tech would be trained to provide that. So essentially, anyone that is a resident of Madison County and has gotten behind on their energy assistance or their rent payment or mortgage and can show how they can, if they're caught up, they can show how they can pay for it the next month. That would be what I want to earmark that money for, to help them provide for that, since Margot's budget got cut so drastically. And then number of vacant positions, I put one since I've already found a tech. It's my supervisor position. And then the next is the budget for the whole fiscal year 24. We spent $32,900, and remaining at the beginning of this year we had $30,874. And then the other one is just the budget through July. What's remaining? So I have $14,223 left in the budget. I attached the request that I sent to everybody. That's the next packet. And then the foster parent reimbursement policy. I think there was a couple. So in the budget request that I sent you guys, I spelled out a lot more detail. In 24, we were able to spend a little over $5,000 to purchase book bags for the back to school bash that Family Connection Mark put on. We helped them buy that. Then we also spent a little over $1,900 purchasing backpacks for our foster children and the children served through our family preservation. And then I did put in there about that trip for the foster kiddos. And then the last one is just our foster parent reimbursement policy. I can't remember if the last time I presented if I let you guys know. The only thing that we really changed in this was we did change the hair grooming. They can spend up to $60 per month and then up to $200 3 times a year. That's for if our foster children have a big prom. It's for if someone wants to get braids, perms, highlights, that sort of thing. Our foster parents sometimes utilize that. It's not utilized a lot. They usually pay it out of their pocket, but they know it's there. And we let everyone know when my board approves the request. One thing also, clothing allowance. So the state gives $690 a year per child in clothing allowance to foster parents. That's not a whole lot, especially if you have teenagers. So we do have it where we provide $450 additional out of county funds. Again, that's really hit or miss if they choose to use it or not. They're aware of it. Sometimes they do. Sometimes they just buy clothes out of their pocket for the kids. That's all I have. What questions do you have?
Thank you. That was a very well detailed presentation. I really appreciate it. I'm assuming, the board appreciates it also. Couple questions. So amount remaining is $14,223. That is from the previous county money in reserve, I guess you say. Okay, perfect.
Yes, sir.
I want to make sure that I did understand that.
But it was a reserve that was allocated to that year.
That was when, so we did not get county funds for 25. Because of the amount of reserves we had when I came into this position last year in January.
Correct.
Yeah. So
there's a certain amount designated for that year.
So previously it was 33.5.
So what my question is that 14,000 remaining, is that of the 33,000 that was dedicated for that year, or is it total?
That's total.
So actually, I think we went 2 years.
2 years, because I didn't get any money in 24 or 25 because when I started, I didn't bring that, but,
We had an excessive.
yeah, it was
amount.
like 50-something thousand.
And we had to burn that off and before the board would consider giving more.
Correct.
So currently, we have 14, and the board could consider using the 14 out of that lump sum if they chose to go back to zero, and or the request is for 45. Correct?
Say that again, I'm sorry.
I said, if the board chooses to, let's just say 45, they could minus the 14,223 and say, just use the remaining of that balance to add to it, because it's still sitting there, correct?
Yes, but that was what I was looking at using for the rest of the year.
Okay.
Does that make sense? Like the
This year?
14,000 this year.
Okay,
'Cause I-
okay, yeah, never mind, 2026, yeah.
So the 14,000's encumbered, you haven't spent it, but you anticipate spending it before the new budget year starts.
That is correct.
Now, I completely understand, thank you.
So there'll be zero.
Give or take some, yes. There may be a little bit left over. I don't know that there will be, because also one thing, the reason why this is, this year, 25, I'm a little over than what I was planning on is we did not, when we bought Christmas presents, it got pulled out in February and not December, just because checks and balances, and that's when it got put in the budget. So the 2,200 Christmas gifts for foster care, we spent it in December, but it put in our budget in February. That's when all the checks and balances went in, so.
Question on the extra, was it 5,000, for the Action Incorporated from Margot?
Mm-hmm.
All right, how does that correlate with District 9 doing the heating assistance and the cooling assistance and stuff like that? Is this just a completely separate?
Yes.
Because we do that through District 9, which is through Action also, indirectly, I guess you could say. I don't have the number, she's preparing a sheet, but I want to say Madison County residents received like $280,000, because they had a huge turnout.
Mm-hmm.
But it could have been better because they still had a lot of money left to give away and not enough people came in. So that's the reason we pushed it pretty hard through the county websites to try to get people out for that.
Right.
So essentially the only thing difference is the rental assistance. I don't think they do rental in that. I think it's just heating or cooling assistance. I don't know.
Okay.
But I have to look into that to make sure we're not overlapping with the same funding.
Right.
Okay. Any questions, Joe?
On the policy, maybe sound like nitpicking, I'm curious. On the policy, it talks about, you got notations where receipts are required and receipts are not required for the reimbursement. But what was the thinking on the gifts, like birthday, Christmas gift, I mean, what?
So the thinking for that is if receipts are required, if the foster parent, especially for, Christmas gifts, we changed it to where receipts are not required. If we require them to turn in receipts, then they have to purchase it in advance. If no receipt is required, then they can put it on their invoice that they submit to our accounting. And each child would be given a specific amount, so they can just put that amount the prior month, say October, November, and say this is gonna be what I spend on this child for Christmas. So it does not require them to purchase out of their pocket, where if they have to turn in a receipt, then they have to purchase it.
So it's an allowance for that purchase.
Mm-hmm.
Do they turn the receipt after the fact?
They can, we can request that they do. This is the first time, that was another change, I forgot about that change, I'm glad you brought it up. This is the first time we did it, they did not, this was not set like that last year. Which is why we spent so much county funds, and my staff we had to go shopping for the kiddos. I'm also, one other thing I'm gonna do is, I'm gonna have my tech reach out to the community. I did some, but I wasn't able to do as much as I'd like to see if we could get some sponsors for Christmas so that we don't have to use as much county funds on Christmas gifts, or the gifts too. Foster parents do, usually buy more than what they receive and more than what they turn their receipts in for.
Do y'all still do, I know it may not have been Madison County, Athens used to do the Angel Tree Project remember that, I'm sure.
Yes,
Do we have those? Do we do those anymore for Christmas?
I tried this past year, because I've done it when your wife did it, and Clark when I was there, and then when she left, she taught me how. So I did it there. I tried to do it, but I could not get out in the community as much as I wanted, so that's another task for the tech I'm gonna get. I did do some emails and cold calls, phone calls, but I think face-to-face interaction is a lot better. You can explain it a little bit more and see what they're willing to offer. So I am gonna have my tech reach out to some businesses and organizations and that sort of thing. Jackson MC did provide some gifts for some of our children. So I have a list of everybody that did provide that I'll reach out to. And like I said, the tech will do some face-to-face visits and see if we can help. So yeah, I do plan to do that again.
A lot of the utility providers were some of the largest donations, Georgia Power, Jackson MC, Atlanta Gas Light, you know, a lot of those come through even in the rural counties, but again, you gotta get in that mix.
Right.
Yeah, and I dealt with, Amy Tree through Caterpillar when we tried to do it, but last year they seemed to have a bunch of issues with just communications and stuff like that. I don't know what happened, I think some people changed or something, and so, you know. And the other problem with that is that you submitted, it's like, what do you can't really plan exactly what you're, you know, if the foster parent, I guess, is, trying to let the kids have a unique something that they would like to get, doesn't have to be expensive, but just something that they know they want, sometimes it's hard to coordinate with outside agents unless they've given you the money and let you go buy it.
Yeah. The way I do it is my case managers, when they go on their visits in October, November, they take a wish list and they have the child fill out the wish list with whatever they want. And it just has the child's first name and it's assigned a number off of a spreadsheet that I keep. And so if I have a sponsor, I'll email, text, send them the wish list and they buy what they want. There's no set amount. They can buy everything on it. They can buy a few things. And that's how I usually do it. So they have an idea. And on that wish list too, it says like what's their favorite movie, what's their favorite color, favorite candy, just in case they want to get stocking stuffers, or maybe they can't find a black hoodie, but they like Spider-Man and found a Spider-Man hoodie. So it has unique details that they like, as well as items. And I really tried to get, in previous counties I've worked at, I've had a lot of success with the faith-based organizations. Churches usually will step in, and I tried to get some of those. I just didn't have time, so I'm going to have my tech kind of go and talk to them and see, because I do think they will help if they can, if they're not already doing something too. I think some of them were already doing different things.
Any other questions, gentlemen? All right, thank you.
Thank you.
Y'all have a great evening.
Y'all too.
All right. Madison County Library, 2026 budget request.
Hello.
Hello. Thank you for coming tonight. I don't know how you drew the short straw and ended up at the bottom of the list, but somebody had to be at the bottom.
You saved the best for last.
That's the best for last, Ms. Morris, I knew you'd say that.
Yeah, I can. Oh, right. I'd like to introduce Beth McIntyre. She is the executive director of the Athens Regional Library System, and she's going to talk some this evening.
Absolutely.
And I believe also that Katie, you're going to speak.
I was just going to introduce Beth.
Oh, okay.
I'm glad
sorry.
to do that. That's all right.
Okay, so I'm going to let Beth take it from here.
Hi.
How are you doing?
Thank you for this opportunity to talk with you for just a minute. I wasn't sure if I was going to be the main person speaking or not. I'm kind of I'm nervous, I'll tell you I'm nervous. I'm kind of better behind the scenes and putting the paperwork together. What Alita gave you was the packet that you should have already received. And so, we just wanted to make sure that you had, that we were all looking at the same page, librarian, sorry, not looking at it. But the first document that I wanted to show you was a revision of your budget summary. Because the revision is based on some questions that we understand, that some of you had about our part-time versus, full-time people. We have, 7, employees, and only 3 of them are full-time. So that means that only 3 of them are eligible for teacher's retirement, and eligible for, health insurance, state health. So that's what that, revision explains to you, because we were really concentrating, and I was not here when this was written. I started March 17th, so I'm still new here. But so I wasn't here when this was first written. We were concentrating on letting you know that the state health benefit plan had dramatically increased.
It all has, huh?
Yeah, right, exactly. And then the teacher's retirement system also did increase. So we concentrated our request on those. But that's only for less than half of the employees. The main reason that we're requesting an increase is so that we can, reward our staff, at least just bring them up to the level that other Madison County employees are paid. When people think about libraries, they think about books, right? That's the most important part of the library. Well, the most important part of the library is our people. That's our most valuable resource. And you can see that over 80% of our funding goes to our incredible staff. The majority of our staff have college degrees. And they're being paid starting at $10 an hour. It's hard for me to say that. So our request is to bring them up to starting at $15 an hour. I know you've got a lot of numbers in front of you. I'll be happy to answer any questions about that.
So I'm going back to the first presenter, Travis Tankersley, with UGA. So you have this roughly the same numbers. The increase rate this year is 20.78, and it's going to go to 21.91. The only difference is you guys went ahead and filled in the blank a little bit further, saying the increase beginning July 1st will go to 22.32. And it really caught me off guard because I wonder if that's something we need to note in the 4-H numbers.
26.
Mm-hmm. Yeah.
Yeah, July 26th.
Halfway through the year.
Yeah, halfway through the year. See, Mr. Tankersley didn't have that in his. I just happened to think about that when I saw that correlation.
The state is,
check on.
you're right, the state is on the July 1st fiscal year, and they've already told us they're going to increase again July 1.
We may need to take into account for that.
Here.
What?
Okay.
Yeah, it's the same for everybody.
Yeah.
Now, that's just for the TRS part of it. So, has the state let you all know about the COLAs, that they're not doing COLAs this year, or are you all aware of that?
If we're going to talk about state funding, I wanted to give you another document that explains that a little bit more. No.
We're still trying to figure it out as we go, because we're just hearing about it.
Okay, well, no one at the Madison County Library is directly paid with state funds except for the library manager's $6,300 supplement that she gets directly from the state. The state-funded librarians all are at the regional office.
Okay.
We have 8 state positions. I'm sorry.
Still
You get
no
that one
shit.
too? I got plenty. I just get fumble fingers passing them out. We have 8 state paid positions for the, regional system. And we pay about 12 and a half people with those 8 positions. Plus, we give that supplement to the library managers in the region. I've never seen a library system give direct state funding to the library managers. It always goes just to regional office staff. But that was a precedent that was set before I got here, and it's a wonderful thing, of course.
Yeah, I always get confused because they follow the state with retirement plans and the health insurance, but they don't follow state payroll policies, and it just, which if they did, it'd be a lot more lucrative, don't get me wrong.
Yeah.
It's just really hard for us to balance what's what
Yeah.
when it comes to our budget.
Yeah, the library system is kind of a redheaded stepchild, at the state. We're under the Board of Regents, but we have to fight for, even though we're under teachers' retirement, if the teachers get any kind of increase, we have to fight for that, and sometimes we get it, sometimes we don't. So, yeah, it's true. My husband's a middle school teacher, and he got the $1,000 one time, $2,000 another time, and the librarians, no, we don't see any of that. So, but since we're talking about state funding, the back of the sheet that I just gave you has the fine print. I have been asked several times, well, what does regional office pay for? Besides the $6,000 that I just told you about, for the manager. State materials, regional office pays for the materials, it's 70 cents per capita. So that's over $23,000 for Madison County. That has gone from, when I first started, there was no state money for materials. And you know, when I say materials, I mean books and other things for people to check out. That's what that is. And so through advocacy from people, library directors, people like me, go into the Capitol all the time. People like our fantastic board members go to the Capitol and advocate for materials funding. We've been able to increase that from literally nothing in 2011 to 70 cents per capita now. And our goal is $1 per capita, so we keep doing that. The other thing that is not obvious that the state pays for is your internet access. Pay the whole thing. Federal funds, E-rate funds pay for 90% of it, and then the Georgia Public Library Service picks up the other 10%, and we act as conduit for those funds. I mentioned the state LibTech grant, just a little over $3,000 this year, but we got a little over $60,000, I think, in total, and then we distribute that to where it is needed. So some years you might get $10,000 worth of computers, some years you might get $2,000. It just depends on the replacement plans and, you know, how old your computers are. The state salary supplement I already mentioned. You know that your library card is not just for Madison County Library, right? It's for the state. Pines is almost the entire state, except for the big boys, you know, except for Gwinnett, and Cobb and Fulton and things like that. But you can use your library card at almost any library in the state. You can check out things. You can have things brought to you from Savannah, from South Georgia, for you to check out, and then you just return them right back to your library, and we send them back home, back on its way. So Pines is kind of hard to monetize, but I took the whole Pines state budget over $3 million, and then I divided that by the number of counties in the state. So I ended up with that number, with over $20,000 that Pines is worth to you. The shared benefits, everybody benefits from our Libby. Y'all know Libby? You know Libby? Libby, the ebook and audiobook platform. You know about Audible? No?
I didn't know.
No, do you?
I know what it is, so.
Oh, thank you.
It's great.
Do you prefer print books? I guess. Do you prefer reading in print? Right?
I do,
Yeah, a lot of people say, oh, I like, there we go. I like the feel of a book. I would rather have a book in my hand instead of, audio or an electronic book. Well, my favorite analogy about that is the invention of the escalator did not mean the demise of the stairs. So we have, of course, all the print books, that you need, and then we also have, our electronic collection, which, is another consortium, like Pine, that we're a member of. So you have access to, digital resources from across the state. But this is how much we invest. The regional system invests over $260,000 in those electronic resources. And then there's additional. There's the web hosting, the online calendar, the antivirus, all the, the background stuff for over $269,000 worth. And then the shared benefits B, that is the people that are paid by state funds that we already mentioned at regional office. And we provide expertise in all of those different areas for your library. And you're looking at 20% of that since you're one county out of 5. And that comes to over $251,000 in benefits. Then there's things that we can't monetize, that they're just everywhere. Galileo, your research databases, Mango language learning, the eRead Kids is online ebooks for kids across the state, our genealogy databases. So it's just hard to say how much those are worth. But even if you don't count them, you've got almost $600,000 worth of benefits total. Oh, that was neat. I really had fun putting those numbers together.
Very good.
Good job.
The ebook thing that you're talking about,
Mm-hmm.
do you check out a device, like from the library, and that gives you access to it, or do you just have a login and you, whatever little magic box you got at home, you use?
You use your phone. Yeah, a lot of people, of course, the audio books are usually on your phone, and then a lot of people use tablets to read the ebooks. I'm a librarian that's kind of addicted to my tablet instead of my print books, but you can read in the dark like that. So yeah, that's the way that works. Now we also do check out devices. If people need to use a Chromebook, they can check one out from the library and take it home.
So I got a few questions,
Okay.
obviously. Sorry.
I'll do my best.
Not
And
personal,
thank goodness, I got
So you have
all these
seven employees, 3 full-time, 4 part-time.
Yes,
And one of the full-time is the manager,
yes,
correct?
correct.
All right. And I'm not, don't take this personal in any way, but I just got questions because we're talking numbers and we're talking a large increase over last year.
Mm-hmm.
So I've got to dissect that. So, are you over the surrounding counties also?
5 counties.
5 counties.
Yes, and since I'm kind of new, but I can list them. I got Athens, Clark, Madison, Franklin, Oglethorpe, and Oconee.
Perfect.
Area.
Good. That means you're going to be able to help me with these numbers. So, help me understand the difference between the proposed budget request for Madison County versus the proposed budget from Franklin County. So, I'm asking that Franklin County has 1 full-time person, I think, and like 7, 8, or 9 part-time people. They have 2 libraries. And with those, when I look down on the expenditures, because I called today and asked, we pay $12,600 in cleaning services. That's $1,000 a month, $1,050 a month. Franklin County pays no cleaning service.
They
So they're
just,
part-time people that do it.
yeah, they've just gotten, thank goodness, they've gotten one person to bid. They can't pay anything in Franklin County, so that's why they have a hard time getting a cleaning service.
So I know in one of the documents I've read here, somewhere, I think, I'm trying not to create a gap that's gonna be a problem. So here, I think we paid $9.50 currently, and you're looking to go to $12 for the part-time. Is that a mistake? I don't know which paper I had it on.
It's $10 now,
It's
starting.
10 now here,
Yes,
and we were talking about going to 12.
and we're talking about going to 15.
I think you're thinking
Well,
of
you're
the
looking at the
substitute.
substitutes, and I was gonna have, explain to me how the substitutes work.
Yes, please.
We do have one one part-time employee that is $10 an hour.
Okay, so we have one at 10, and then I have 3 at what?
1081.
1080, you got 1051, 1081, you got a 1430, 1483, a 1583, and then, a $20.35.
Okay. I'm gonna need that.
Do you have that?
It's in the packet.
It's in the packet.
Oh, never mind.
It's this year.
Yeah,
payroll.
it's
It's over on the
payroll.
back sheet, sorry.
Let me see.
Now, I'm interested in the fact that you're comparing to Franklin County. We're actually cutting Franklin County's hours. Franklin County can't, they can't hire anybody that will stay. People will take their money for, just a couple months, and then they'll leave. And the turnover is incredible, and we have so many empty positions now. We've asked Franklin County for an increase. And then they came back and said, well, we're not gonna go to $15 an hour, but we might go to $12.50. And then we worked with them on that, and then they said, oh no, we're just gonna give you $6,000 total. So we're gonna have to cut the library hours. We're cutting them from 40 hours each week to 28 hours each week, which is really, really sad. I've never seen that dramatic of an decrease. We had to do it in Winder one time because we didn't have the funding. But thank goodness, the county stepped up.
Yeah, at one point, both Franklin counties actually closed from recent newspaper article. And then
really?
I
haven't.
Yeah, you haven't been there that long, sorry. I just read it in the Franklin County paper that they closed both their libraries because of state funding got cut. But I'm not aware of any state funding that got cut. But then they reopened because the county give them like $25,000 or something, so they reopened. And I really don't care what's going on in Franklin County. I'm more worried about the expenditures for Madison County versus the expenditures that Franklin County operates, and they're operating 2 libraries with almost way more employees in Franklin County, but they're doing it somehow at $130,000 difference.
Because you're just saying they're not gonna be able to do that, right?
Exactly.
But at $130,000, even if that ain't $2 an hour times 8 people, or we only have 4 people, sorry. Because if we're already at 10, 11, and 12, and 14 on the part-times, even if they went to 15, won't total $150,000. I'm just, and I'm not being critical, I'm just trying to make sure that everybody's treated across the board fairly.
That's what I'm supposed to do.
Right.
Right.
I do wanna say though, they do have openings right now they can't fill.
Yeah.
Yeah.
I mean, that is why they're closed down. They're not, they are only open like 3 days one place and 3 days another.
We're back open now, but I don't know for how long.
Well, they're open, but they're just not open to full capacity of the hours that they have been operating at.
Gotcha.
So I think that's where it is. They're open 3 days one location, 3 days another location. They're not open on the weekends.
They're cutting their hours as of September 1st. We just started advertising and letting people know that their libraries won't be open when they need them as of September 1st.
What is on our part-time employees, what is our attrition rate with that? Are these folks how long have you had your part-time employees?
Ours tend to stay fairly well. The one who's been there the shortest period of time, is, she's going on 6 months, and then everybody else has been there at least a couple of years.
But other than the salary that they get, they receive no benefits, state or local benefits, other than just the hours they work.
Correct, yes, sir.
They get access to an employee assistance program, which is for their mental health. We pay for that, and they get access to Calm, as a software, it's also for mental health.
But no tangible benefits.
No health insurance,
No
no
health
retirement.
Right.
So this
How many hours is the average?
Well, we can't hire them more than 19, because that means that we have to pay.
And that's fine, that's what I mean, so maximum 19, the part-time is maximum 19.
Well, they got, she's got 17, 16, 16, and 8 for her people.
Halftime, I mean, just round numbers.
Yeah.
So we have 4 of those, right?
Yeah, so you've got one at 17, one at 8, one at 16, and another 62 at 16.
So, yeah, one is only 8 hours a week, so that's much less than half.
And someone asked how many hours the part-time people work, and, Lori ran those numbers for us, and it was over 3,000 hours last calendar year, that the part-time people worked.
Total. So if you raised,
For 3,000 total hours, if you went from $10 to $15 an hour, 15, right?
mm-hmm, yeah.
Well, that's why, and this is Lori, I don't know, y'all, Lori Swanson is our, business manager. She's a whiz. She is amazing with the spreadsheets. These calculations that y'all are kind of doing in your head, she's already done them right here. So you can see how each one goes from 1051 to 15, what the difference is, what their annual's gonna be, the taxes. She's already calculated all that. That, you know what TRS stands for. That GHI, of course, is the Georgia, the health benefits. Flat fee, over $22,000 a year, the employer pays.
Play with that, yeah.
That flat fee, over $22,620, that's what the employer pays for a full-time employee to have health benefits. That's why we can't hire full-time people. And anytime we have a full-time person leave, I go to the manager and say, I want to hire 2 part-time for 19 each. Because that's craziness right there. They mean well, the state means well, because they don't pass along as much of an increase to the employee. The employee insurance rates, they go up, but they don't go up that much.
Gotcha.
That was 18, was it? No, it was 18, less than 18,000 a year, just a couple of years ago.
What's current cost on our employee insurance, about $10,000 a year?
Do you know where the cost for insurance is, employee insurance, 283?
Employee insurance, the total premium, I think this time it's over 900 for just an employee only.
That's the employee paying.
No, that's the total premium per employee. I don't have the total breakdown.
It's about 10,900 a year.
Yeah.
I mean, that's, throw it against the wall, that's what it's gonna come to.
That's what it's gonna be, yeah.
We're paying twice as much. And we've had lawyers at the state level, we've had the state librarians go to all these different people and say, we want to get on county
Well,
insurance.
to be honest, I don't know why y'all are under the state healthcare program. The school hates being under the state healthcare program also because it's so expensive. And you can't go out shopping every time there's an increase because they're stuck.
Mm-hmm.
Obviously, y'all are not stuck.
No, we are. That's what I was just saying, that we've talked to lawyers, the state librarian has talked to all these different people saying, we wanna go somewhere else, and we can't, we are stuck.
So the only way to be unstuck is if we separate a relationship, we disbanded from Athens Regional Library, and we just had Madison County Library.
And we hired you directly and hired your help directly.
If they became Madison County employees.
Mm-hmm.
He was right about the redheaded stepchild part. It's so convoluted of what's state, what's not state, what's county.
Mm-hmm.
Yeah.
And there are counties, I'm sorry, I wanna go follow that train of thought, because there are counties that do, employ, well, where I came from, like, the cities were actually paying their library employees. The advantage to that I have seen is that counties and cities will fund their libraries better because they feel more ownership to the staff. The disadvantage, and I'm not gonna apologize for this, librarians should run libraries. And that's what regional office does. And when we have that relationship where they are our employees, that means, because I've had it both ways, that means I can make them do things. When they're not my employees, but I'm the regional director, I have to suggest that they do things. And we're much more effective as librarians when we have that employee-employer relationship.
Thank you. Question, regional share. On the budget, it says regional share, and there's a percentage of that. Where does that come to be? How does it come to be?
Regional share is a, per capita, is it 50 cents?
58.5%. Yeah.
It's per capita, so, you know, Athens Clark is paying a heck of a lot more. It went up this time because we haven't looked at your population increase in about 3 or 4 years. So that's the only reason it went up. It didn't go up per capita.
I did notice that on one of the sheets. I don't remember which sheet again it was, but I think y'all use an estimated census yearly.
It's what the state.
Yeah,
the state
we're not allowed, I mean, we use the true census. We can't use an estimated census.
I know, and the 2020, of course, is the last one.
Yeah.
That's real. But we can't use that. That's just way too far back. So we use the Office of Planning and Budget. The Office of Planning and Budget tells us how much, you saw the state, materials amount is 70 cents per capita.
Yeah.
And that's the population they use for that 70 cents per capita.
Yeah. Yeah, I think y'all had a number of like 33,000 something.
568.
Yeah, 568, and see, the census said 30,128. And we were just doing some other math and some other budgeting. We used the 30,128 at our time because that's the official census.
I hear what you're saying.
Yeah.
We have to treat everybody equitably. We raise the populations on all of them.
We hope they get the next census right. We just hope. I don't think I'm gonna live that long. Maybe 2030, but.
Yeah.
All right, well, thank you for the regional share, understanding, because I did not.
And you get more in state materials per capita than you're paying.
All right. Well, any other questions, gentlemen?
I would think we had some other people that wanted to say a few words.
Come on.
Derek, one thing to point out, that is saving the $5 per hour request on all of their hours.
Yeah.
Not just part-time.
I just catching up on that.
That is the request, yes.
Yeah.
We wouldn't pay part-time more than full-time or vice versa, because they do the same job.
Just for the record, the maximum county employees get is 3%.
Okay, and we looked at a salary survey y'all did, a couple of years ago, and we saw that the 15 people that were being paid $15 an hour were like custodians, clerks, machine operators.
They might want to come to work for us. They get it.
Yeah, these people that work at the library are just, I mean, they never know what they're gonna have to do.
No, I get it.
Always.
I'm not being disrespectful. I just want, we upset the apple cart massively when we do for one, we don't do for the other.
Part-time employees, what's our rate of part-time employees?
It's different.
It's different. Yeah, so we have some that's $12.83, for part-time. Yeah, I mean, it's just something we gotta look at, I'm being honest.
But when we do.
I just don't wanna set an
we have some
expectation.
part-time still for benefits.
75% employees, I think. do.
30 hours.
Yep. So you have to work a certain hour bracket.
30 or 32, something like that.
30 hours is
30 hours part-time.
part-time for us.
No, I hear what you're saying, and I've heard a lot, and a lot of different counties.
Yeah.
That's what they say, but I maintain that the library is special.
Oh, it
It's
is.
different.
We have an excellent young lady that's running it. We have nothing, she comes before us quarterly, gives us grade reports. We have nothing but positive feedback from the community about it. And I'll just be frank with you up front. We're sitting here tonight and I'm 1.86, 1.84 million over budget in request. Literally. I spent all day Thursday, all day, today, all day trying to figure out how I'm shaving this. So I'm not trying to set an expectation, of fear by no means, at this time, because there's still a lot. Y'all are the first meeting we had, the first group out of, you're the first 10 out of probably 40 we're going to hear from. But I'm very thankful of the job you do, and we will give it every consideration possible, every which way we can give it. Great presentation tonight. Always great to see you and the staff. A lot of smiling faces, especially old Zach in the back. We don't get to see him very often.
Well, I know you guys are pulled in all different directions, and we appreciate any increase that you can give us, and I know we're less than 2% of your total budget, so there's that too. We're tiny.
And welcome aboard, by the way. It's brand new. Welcome aboard. I hope this wasn't trial by fire. I hope you know that,
I don't have to do this very often, so thank you for putting up with me.
Yeah, you ought to let Miss Elizabeth do it. She'll throw things. Gentlemen, any other questions for this, for anybody in the room?
Somebody else wants to speak?
Yeah, there were.
Anybody else want to say anything?
I think you covered it. I'm the chair, this year of the library
She's
board.
my boss.
Yeah. We're so grateful for Beth and all the staff. I hope that presentation was more enlightening than years past. I think this is my third year volunteering on this board, and it's been really encouraging from our perspective as board members to see the information come to light and have a better understanding. To your point, it is a convoluted process. The only thing I think left that Beth did not touch on is that, no, I don't know if this relates to budget, so excuse me, but we know that the HVAC units are at end of life, nearing end of life. The state library often has access to MRR funds, so it's a 50% match. The entity has to pay up front, and then 50% is reimbursed. That's just something I want to be on everyone's radar. I think it's always better to do preventative maintenance when possible than emergency maintenance. I know we've had lots of water, lots of tree issues there, so thank you to Alan's team for getting that done. But that's just something I want to be on our radar. We want to be creative to find the funds to make that happen. I think utilizing the MMR funds from the state is a smart thing to do, but we've got a plan. And because, she said lots of people are fighting for all that money. So we've got to make sure that we do it the right way if we're going to handle it that way.
Do we have a current problem with the AC units? Or we're trying to, I know we've had a lot of AC problems this summer.
Yeah, we've definitely had recent problems, and it seems like it's better now, but also it's been cooler outside, so it's a little hard to say.
This false hope of August, I guess.
Right.
Okay.
Yeah, I think Paul's been over there working on the system, trying to get some things enabled.
This summer has hit us harder with AC units.
Yeah.
We've been $40,000 a pop 5 or 6 times now.
So again, I want that to be on our radar. There's some very minor tree work that needs to be done at that building. It's really just limbing up some trees that are causing issues with the gutters. That's something that we have enough funds in our reserves that we can handle.
And then, we just partnered with you guys before too on a roof, for roof repair.
absolutely.
So,
Right,
so you, the library board paid, I think,
Yep.
half of that, and the county paid
Yep,
for
so
half.
that's the MRR fund, so that's putting those funds to work, which is great, because that's the county building, but that's another place you get to leverage this kind of tricky state dollars to benefit us directly.
And thank you all for getting on that, we very much appreciate.
Yeah. It was like right before a big storm came or something. It was
Yeah.
always-
They had literal water coming
Yeah,
down.
yeah, Alan told me.
Yeah. And then the only, that I'll leave on this, but I would really encourage and challenge you all to find a way to pay our librarians what they're worth. I know that it's behind, I know it's difficult to not upset people, but they've been underpaid based on a precedent that was not accurate. So I think that is a valid reason to pay them what they're worth. And yeah, you're gonna make someone upset, but I think it's important for us to recognize that they have been severely underpaid based on lack of information. I don't wanna blame anyone.
Based on the substance they were getting those.
Correct. So I encourage you guys to please consider that.
And let me ask you this, on the staffing of 7 people, is 7 people enough? Is 7 people marginable? Is 7 people, I could probably get rid of one if I could make another full-time, or I could get rid of one to free up funding for potential raises throughout? I mean, these are things I have to deal with every day, is to say, okay, do you really need all of them, or can I remove one and disperse that salary amongst the others?
I would say we definitely need all of them.
Okay.
Especially, I do have to call subs in sometimes.
Okay.
We're okay with where we are staffing wise, but I think we would be severely hurting if we lost anybody.
Okay. Yeah, I'm just throwing it out there,
Yeah.
I'm just trying to figure out ways to make things happen.
Thank you.
Thank you.
Yeah, thank you.
Anybody else before we wrap it up? Like, not me.
I wasn't saying, I'm a chit chatter, so.
Oh, yes, y'all look at her. Elizabeth Allen from the Department of Health. Remember? I told you she has some twins, longer hair. That's her. All right, if there's nothing else, Commissioner Dawson. Thank you.
And if anything does come up, y'all know how to get in touch with me, and so
Thank you. Also, Derek Beth is a Rotarian. She's in Jefferson.
Do I now?
Are you Jackson County or Jefferson?
I am now Plastic City.
Okay.
My 4 club.
Oh, yeah, she came. I forgot.
I was the president of the Lions Club for several years. And then I was the Lions Club, and then I co-founded the Barrow Area Rotary Club. Which is what, Lions Club.
This is like comparing Layerville.
But now, I'm in Plastic City.
I mean, there's going to be a hell of a lot less operating costs for, you know,
I'm not gonna judge it.
yeah, or you need less staff.
Yeah.
I didn't mean to interrupt your conversation.
Will you have it?
Girl.